checking my orders, I'm gathering my supplies, washing my hands, and hi there, Mr. Smith. I'm Lindsay. I'm going to be your nurse today. How are you? Great. If I can get your first, last name, as well as your date of birth. Perfect. Mr. Smith, I've got your IV fluids for you today. I've got your primary bag. That's going to be for hydration. I've got your medication, which is going to be in your secondary bag. I did check. There are no contraindications or allergies, so we're all set to go. First thing I want to do, though, is I want to take a look at your insertion site. So for my patient, it would be the insertion site here. What I'm going to do is I want to make sure there's no pain, swelling, redness, anything of the sort. Make sure it is CDI, also known as clear, dry, and intact. I'm also going to want to check the patency. So for this, I am going to scrub the hub, if there were one, for 15 seconds. I'm going to take a normal syringe full of saline. I'm going to attach it to the port. I'm going to squirt some of it in, make sure it's flowing through. When that's done, I'm going to disconnect it and make sure that my port is clamped. I'm then going to move on to my primary bag, which is this bag here. Again, this is for hydration purposes for the most part. So first thing I'm going to do is grab my tubing. When I get my tubing, I want to make sure that I have it clamped, which is already clamped, but I want it to be clamped in order to lose the smallest amount of fluid as possible. From there, I'm going to remove my spike cover. I have my bag. I'm going in this port right here. Once I spike that, I squeeze to make sure that my drip chamber is about half the way full. And then when I prime it, I want to slowly unlock or unclamp and let the fluid flow through, getting rid of all of my air bubbles and spilling as little as possible. You can see that. So and I have practiced some, so I am spilling a little bit. There we go. So you can see there's a little bit there. Moving on from there, I'm going to get my secondary bag ready. So first I'm going to take my hanger and I'm going to hang my primary bag lower than my secondary. The reason for this is I want the gravity to help infuse that medication quicker. So for this one, again, I'm going to gather my tubing. Very, very important. It's crucial with the medicine that we make sure that it is locked all the way, because we do not want to lose any of the medication and then have to worry about if we were to spill some, how much we spilled, so on and so forth. So as you can see, it is locked here. Again, I'm going to remove my spike cover. Here's my bag here. I'm removing this side. Spike this guy. Fill the drip chamber about half the way full. And again, I'm going to hang this one higher than my primary. If you can see, try to not block you. Perfect. And I am going to also prime this one as well. Okay. Lock that, making sure that we are set there. And last but not least, I am going to grab another alcohol wipe, and I'm going to attach my secondary bag to my primary bag. I want to attach it with the port that's closest to that primary bag. Oh, caught that. Get that bad boy up there. And what's very important for this, I want to leave my caps on as long as I can in order to keep them as sterile as possible. But I am going to scrub my hub for 15 seconds. Then I am going to attach. There you are. And then I am also going to make sure Mr. Smith has no more questions, and I'm going to document everything and come back and check in about 15-20 minutes.